Welcome to the Central Rad Podcast, the podcast that keeps you focused right where it matters on the knowledge and confidence to succeed as a radiographer. I'm Ryan Ross, your host, and I'll be guiding you through a series of episodes designed to help you prepare for the ARRT Radiography Registry exam, or to simply sharpen your skills if you're a working technologist keeping up with your CQR requirements. Hello everyone, and welcome back to this Registry Review series. Today we are tackling one of the most important and sometimes intimidating topics in patient care: medical emergencies. Now, I know what you might be thinking. I'm not a doctor. Why do I need to know all of this? Well, here's the thing. As radiologic technologists, we are often the first ones to spot when something is wrong. Sometimes we're the only clinical professional in the room with the patient when an emergency strikes. Knowing what to do, staying calm, and responding effectively can literally save someone's life. And it's also a key part of the ARRT exam content. So grab a coffee or just settle in and let's walk through what you need to know about medical emergencies in the imaging department. We will cover 4 main areas today: non-contrast allergic reactions, cardiac and respiratory arrest, including CPR and AED use, physical injury or trauma, and other medical disorders such as seizures and diabetic reactions. Along the way, I'll throw in some questions to get you thinking and hopefully help you connect the dots. Sound good? Alright then, so let's dive in. Section 1. Non-contrast allergic reactions. You might already associate allergic reactions with contrast media, but don't forget patients can also react to things in the environment, latex, adhesives, or even medications they took before coming in. An allergic reaction, or hypersensitivity reaction, is the immune system overreacting to something harmless to most people. These reactions can range from mild to life-threatening. So how do you recognise one? Think about these signs: hives, itching or rash, swelling of the face, lips or throat, wheezing or difficulty breathing, or a sudden drop in blood pressure. We classify reactions as mild, moderate or severe. Mild might just be some localised hives or itching, still worth monitoring but usually not immediately life-threatening. Moderate could include more widespread rash, mild bronchospasm or facial swelling. Severe, this is where we start to see anaphylaxis, airway swelling, severe bronchospasm, hypotension, and potentially loss of consciousness. So what should you do if you see these symptoms? First, stop the procedure if you can and get help. Call for a physician or a nurse immediately. If you are alone, activate the emergency response system. Position the patient appropriately. Sitting upright can help if they are short of breath, or lay them flat if they are lightheaded from hypotension, sometimes with their leg elevated in Trendelenburg position. And here's a good question to think about. Do you know where the emergency cart and the epinephrine are within your department? If not, make a mental note to find out after this episode. Section 2. Cardiac and respiratory arrest. Now let's talk about one of the scariest but most critical situations when a patient's heart or breathing stops. Cardiac arrest means the heart has stopped pumping effectively. Respiratory arrest means the patient has stopped breathing. Both are life-threatening and require immediate attention. How do you recognise cardiac arrest? Patient may be unresponsive, they may have no normal breathing, and they have no detectable pulse. Current guidelines stress high-quality CPR, and as a reminder, push hard and fast, at least 100 to 120 compressions per minute. The depth should be about 2 inches on an adult. Allow full recoil between compressions and minimise interruptions. And don't forget rescue breathing. 1 breath for every 6 seconds if an advanced airway is in place. If you are in a hospital setting, you will likely have access to an AED, that is an automated external defibrillator. Know where it is and know how to use it. The AED will guide you step by step, analysing the rhythm and advising if a shock is needed. Ask yourself this: when was the last time you refreshed your BLS certification? If it has been a while, it might be time for a refresher, not just for your exam, but for your real-world practice. Section 3. Physical injury or trauma. Sometimes the emergency comes to you in the form of a trauma patient, but injuries can also happen in your department. You might see bleeding, known as hemorrhage, fractures or dislocations, head injuries, or spinal injuries. A few key principles are: don't move the patient unless absolutely necessary, especially if you suspect a spinal injury. Support fractured limbs gently but firmly. Apply pressure to bleeding wounds using clean dressings. And keep the patient warm and calm as shock can set in quickly. For head injuries, watch for changes in level of consciousness, pupils that are unequal or slurred speech, all signs of serious intracranial injury. And here's the question: do you know how to properly log roll a patient to maintain spinal alignment? That's something you might want to review with your team, because improper handling can make a spinal injury worse. Section 4. Other medical disorders, seizures and diabetic reactions. Finally, let's look at some other medical disorders you might encounter. Seizures. A seizure is a sudden, uncontrolled electrical disturbance in the brain. If a patient begins to seize, don't restrain them, move anything dangerous out of the way, cushion their head if you can. Once the seizure stops, turn them on their side to help keep the airway clear. Document how long it lasted and what you observed. That information is valuable to the care team. Diabetic reactions. Patients with diabetes can experience either hypoglycemia, which is low blood sugar, or hyperglycemia, high blood sugar. Hypoglycemia tends to come on quickly, and it can present in sweating, tremors, confusion, and can even progress to unconsciousness. If the patient is awake and able to swallow, give them a quick source of sugar, like juice or glucose tablets. If they're unconscious, call for help immediately. Hyperglycemia develops more slowly but can still be dangerous. You might notice excessive thirst, frequent urination, dry skin, and drowsiness. Both conditions require prompt medical attention, so don't delay notifying the care team. Alright, so take a deep breath. That was a lot, I know, but these are exactly the kinds of scenarios where your knowledge, confidence, and calm demeanour can make all the difference for a patient in crisis. So let's quickly recap. Be able to recognise and respond appropriately to allergic reactions, from mild hives to severe anaphylaxis. Stay current with CPR and AED use, and don't hesitate to start compressions if needed. Handle physical injuries carefully, watching out for spinal precautions and signs of shock. And know how to support patients having seizures or diabetic emergencies, always keeping their safety first. It all boils down to being prepared, knowing your resources, and staying calm. Before we sign off, here are a few thought questions to ponder. 1. Do you know exactly where all the emergency equipment is in your department and how to use it? How would you handle a situation where a patient starts seizing in the middle of an exam? When was the last time you practiced or reviewed your basic life support skills? Think those through and maybe bring them up at your next team meeting. Thank you so much for joining me today on the Radiography Review. Keep up the great work. Your patients and your future self will thank you for it. Until next time, stay sharp, stay confident, and always, take care of yourself and your patients.